The purpose of this intervention is to help staff improve in how they interact with residents living with dementia. We'd like to see them increase the positive interactions that they're using with these residents living with dementia. Positive interactions would be things such as smiling with the resident, giving them some motivation or encouragement to complete a care task, or providing them with some gentle step-by-step instructions, or even just some social chit-chat during the care. If you were a resident and a staff walked into your room unannounced, didn't introduce themselves or say hi to you, and just wheeled you out without saying anything, how would you respond? In these cases, we're very likely to see that the resident does not engage with that interaction because it truly isn't an interaction at all, and that unfortunately that resident is more likely to exhibit some behavioral symptoms of distress. This might be, crying, hitting, kicking, or resisting care. On the flip side, if a staff member walked into the room with a smile on their face, greeted the resident and introduced themselves by name, and then guided the resident through step-by-step instructions of how to transfer from the bed to the wheelchair, and then gave them the motivation that they can do it, how then would you react to that? So that's a much more positive and meaningful interaction. The staff member is no longer rushing you or just not engaging with you. So in these cases, we're more likely to see that the resident becomes an active participant in their care. We're using a 4-step approach that is known to help staff change their behavior and change how they interact or deliver care to residents living with dementia. We'd really like to increase the amount of positive interactions they're exposed to in turn really just improve their well-being, reduce any behavioral symptoms they may have, and reduce their resistiveness to care. For caregivers, we would really love to look at how the use of positive interactions might go on to increase their work satisfaction or reduce caregiver burnout. The 4 steps of this intervention are first, working with the staff to identify some environmental or policy aspects in their assisted living community that may facilitate or hinder a positive interaction. This could be examples of if there's access to chairs that are facing each other that are conducive to conversation, or policies around access to sensory aids for residents. We also do work with staff to provide some education on just increasing the awareness and recognition of how they can be incorporating positive interactions into their care approaches with residents. The third aspect of this intervention is we do help the staff go through their service plans with residents and make sure that it's tailored to the residents' communication preferences and needs, and that the staff consider that when they go on to interact with residents. And the fourth, and maybe the most important step of this intervention, is we have a research facilitator that provides ongoing support, role modeling, and motivation for staff. We're working with 4 assisted living communities, but if we do show that this is effective, we would look at dissemination across a larger number of assisted living communities, and we could even look across other long-term care facilities as well, such as nursing homes. It doesn't need to be just siloed to assisted living facilities. The impact of this work, if it is not done, is unfortunately we are going to continue to see negative interactions occurring in this setting, and then we'll go on to continue to see how these negative interactions impact well-being and behavioral responses for residents. And unfortunately, these behavioral responses for residents are what go on to impact caregiver burden and the caregiver's well-being too.